So we hear a lot about testosterone, okay, and how it relates to mainly sexual performance. People are like, well, I got low T, I'm an older guy, yada yada, sexual performance. So people sometimes when they hear testosterone, they either think performance enhancement drugs or sexual performance enhancement. But testosterone does so much more for the body. For example, cellular growth, healing, maintenance, muscle mass, with your bone density, central nervous system maintenance of opioid receptors, blood-brain barrier. I mean, there's just a list of a bunch of big words here that most people have no idea what all this stuff means and how it even relates to the body. So tell us a little bit about, well, first let's talk about what some of that stuff and what testosterone actually does for the body on a cellular level all the way around, as opposed to just thinking that it's just for my libido.
Yeah, that's great. Of course, professional sports cause a lot of problems
Sure.
with how people think about testosterone.
And the commercials about.
And when the president's on TV saying testosterone is bad and it shouldn't be utilized, that's like going on TV and saying thyroid is bad. Like giving somebody thyroid hormone is performance enhancement, but and I mean, you could give somebody thyroid and they'll metabolize food a lot faster and increase their performance, but you don't hear anybody talk about thyroid.
Yeah.
So there's a lot of myths out there about testosterone, but with the AIDS patients I work with, the cancer patients, the brain injury patients, that's why we have our YouTube channel. A lot of those clients on the YouTube channel had utilized testosterone to get better. I designed a pre and post surgical rehab program. What did I use? Testosterone. Because as the guy's laying there in bed after surgery.
Yeah. So what does it do? Yeah, tell us what it does.
What it does is it helps you maintain your muscle mass.
Okay.
It helps you maintain your heart function.
Okay. Heart's a muscle too.
Yeah, a lot of people don't. They don't think about that. Mm-hmm. We hear that testosterone causes blood clots and heart attacks. Well, if you're taking 500 and 500 intermuscular milligrams of testosterone, a week or every 3 days, and you're doing extremely high dosing to maintain 40 pounds of muscle mass, you're gonna get into trouble. Because that, when you look at a bodybuilder, and I get it, oh, that's my ideal. I want to be fit. I want to look like a bodybuilder. And then you've got endurance athletes going, I want to run, a sub 3 hour marathon. Both those things are unhealthy. Mm-hmm. Now, I don't want all the bodybuilders going, oh, what are you talking about? I'm healthy. I'm like, I don't know. I was a 150-pound triathlete, and then I was a 200-pound weightlifter. I don't feel good with all that muscle mass on me, and you got the pictures. I'd rather be leaner and be able to run. And then in my mind, I'm thinking, if I'm 80 years old, instead of having muscle mass on me, I would sure like to be able to run a mile at 80, in 9 minutes. That shows me that I have cardiovascular function. So I always come at the testosterone therapy from looking at multiple systems of the body. How does the testosterone going to affect my heart and my brain?
Okay.
You know what I mean? So, the programs that I developed for performance enhancement looks at hormones, looks at nutrition, looks at the intestinal tract, and I pull it all together that way. A lot of folks, a lot of guys don't need testosterone.
Because what the levels that you get back from your doc, anywhere from 0 to 1,000, and then anything below 200 is what considered low. So if somebody's at like a 220, the doctor can be like, oh, you're within the range.
Well, right now that's a good question. The testosterone blood work, depending on the lab you go to, and this isn't just with testosterone; it's with everything.
Everything,
Trent. Yeah. There's a wide range. Uh-huh. So a doctor treats the patient. I always tell the doctor when I'm training the doctor, listen to what Trent is saying. I'm tired. I'm fatigued. I'm gaining weight. Not that you're gaining weight, but listen to the patient, because then the doctor looks at the blood work and he goes, "Oh, the testosterone range goes from 200 to 1,000. Yeah. You're normal. You're at 400." And I got to educate the doctor and say, "Listen, he's at 400. His range goes from 200 to 1,000. Why don't we move him up to the 600, 700, 800 range, and then see how he's feeling. See if he gets a little bit more energy, because all the stress he's under at work or all the mileages he's riding on his bike or running, it's lowering his testosterone level."
Because it's the same thing, whether you endurance athlete or you're a CEO at work, it still fatigues the brain, the body.
Physical,
takes an impact.
Physical, mental, and emotional stress. Lower all your hormone levels, not just testosterone. Lowers thyroid function, lowers everything. And I guess that if I could say I had a specialty, that'd be it. At the 11th hour, I kind of understand how physical, mental, and emotional stress compromise the body and can lead to addictions.
Oh gosh.
I lived it myself. I live with professional athletes. I mean, some of the fastest, most talented people, I trained with. I mean, I was never as fast as they were, but I raced for about like 20 years. I did half Ironmans right at 5 hours. I swam 13 miles around the Keys in 5 hours and 7 minutes. I mean, I know what it takes. You know, and I work with people that just have a head of steel. And, you know, they will look for any edge in the world. I mean, performance enhancer.
Well, let's talk about Lance Armstrong, because that's a huge topic of what happened with him. So tell
Yeah.
us what happened with him, the perspective of it, and then just we can go into the reality of it.
Lance, you know, there's a lot of hypocrisy in cycling. And
Yeah.
I remember Lance Armstrong, we did a race. We wanted to go do this race in Florida. Actually, I live in Florida. I think we went to Aventura in the 80s, and I wanted to go race down there because I could see all the top triathletes. Because as I was going out on the course, they were finishing. They were so fast. So, and that was cool about the sport because you got to race with the best people, the guys that were in all the magazines. So me and my crew, we went down there and raced, and I was going out on the course, and the winner was coming in, and the winner wasn't one of the main guys. The winner was Lance Armstrong. I think he was like 16. So I mean, at 16, you beat all the top pros. So
Starting out early.
Yeah. So of course, you know, even controversy back then, everybody goes, "Oh, he cheated," and but when, like any professional athlete that I've dealt with, they always have that epiphany where whether you're over in France cycling or you're playing pro football and you immerse yourself in that culture, they get that wake-up call and they see what everybody's doing. And everybody's using performance-enhancing drugs. It's no secret, and you either play ball or you quit. But these guys are so competitive.
Yeah.
And they're there to win. Like I said, there's no the special forces guys I work with, private military contractors, guys like Lance Armstrong with that head of steel that they have. These are the guys that jump out of the helicopter that come rescue you.
Yeah.
That's and I work with those guys. I mean, you know, that's the mindset they have. So they're over there competing, and everybody is doing performance-enhancing drugs. What are these guys going to do? I mean, they're competitors.
Yeah, but what you say performance-enhancing drugs, and so to the average naysayer or the average person, they're going to think drugs. Oh, they're thinking like heroin, you know, just the regular drugs that you would associate the word drugs with. So performance enhancement drugs. Let's talk about what you would do to enhance your performance without the word drugs in it. Let's go ahead and what you would do with, say, testosterone, or maybe some blood doping.
Okay,
talk
good,
about
good.
That.
Yeah, okay, I got you. So from a bodybuilding standpoint,
Okay.
maintaining 40 pounds of muscle and posing, you know, the list of drugs they're on is long and distinguished. Different types of testosterone, decadurabolin. I mean, they're doing growth hormone. I mean, the list is long and distinguished. So now with the endurance athletes, they're looking more for performance and endurance, and they're doing drugs that improve their red blood cell count.
Okay.
Something like EPO. Okay, EPO elevates your red blood cells. The red blood cells carry more oxygen to the muscle. When you have more oxygen to the muscle, you have less lactic acid. So if you're doing the Tour de France and you're racing over 2,000 miles in 3 weeks, you're able to recover the next day. And they also use testosterone to help maintain their muscle mass and keep the cortisol levels down. You got to do a blood test called hemoglobin and hematocrit, and that measures your blood thickness. So when you do EPO or you're doing testosterone, it actually makes your blood thicker so you could carry more oxygen to the muscle. Well, for a cancer patient or an anemia patient, this is life-saving. But from a performance enhancement side, these guys are experts in tweaking it to take it. You know, they're walking on a razor blade.
Yeah.
You know, but I understand it. I mean, I just study these guys. I mean, I work with them. I done these things myself. It was prescribed to me by a doctor. I never did anything black market, but I study this stuff because these guys are the canaries in the tunnel. Let me tell you what I learned from the bodybuilders when I was writing treatment protocols for AIDS patients. I used a lot of the same stuff they used. I mean, you know, they're not doing double-blind studies on this in universities. Yeah. You know, so you've got to drill down and find the information and do the lab work, and that's why I partnered with these labs in '96. I was always able to look at different parts of the metabolism and then make determinations on how to help somebody.
AIDS patients losing muscle mass,
Exactly.
bodybuilders trying to keep muscle mass.
Yeah, I mean, yeah, exactly. Nobody thinks about that, and they say we developed some really brilliant protocols, but I think it's really simple. You know, like if you got a patient that just broke their hip, like I used to take hip fracture patients. They'd break their hip. I'd pick them up at their home. I'd take them into the emergency room in the hospital. A lot of them would die inside the hospital.
Really?
Yeah, from a hip fracture. So I'm thinking, okay, now we can maintain their muscle mass. We could, you know, your muscles are a reservoir of amino acids and fuel. So as you're laying there recovering from surgery, hip surgery, your body is mining nutrients to heal.
Pull them out of your muscles, right?
Yeah, what if we gave them testosterone and some of these performance-enhancing drugs
To help heal.
to help heal instead of, having them come across the finish line at a faster time? That's where I think the disconnect is.
Yeah.
And,
I don't need performance enhancement drugs. I'm not performing. Well, your body's just took a hit from surgery or whatever.
And listen, I run down the street here in Winter Park. I grew up here in town. Everybody knows me. So they see me running down the street as a 150-pound triathlete, and then I got up to 200 pounds. I started running. I put more muscle mass on me, and they're like, "Oh, you're on the juice." I'm like, "Yeah, it's prescribed to me."
So tell us the difference between that, like how you felt. 150 pounds, 200 pounds. Talk about the difference in your body physiologically.
Well, physiologically, when I was racing as a triathlete, I damaged my body a lot. I really dealt with post-race depression a lot, of course.
Okay.
I didn't want to talk about it.
Because it depletes a lot of your
after a race, you're just done, dude. I mean, I'd swim a mile and a half in the ocean. I would ride 56 miles on the bike, and then I would do a 13-mile run. That was a half Ironman. That's the best I could do. The first half Ironman I ever did took me 7 hours. My last one I did, I was on a 4:40 pace. I finished in 5:07.
Wow.
I threw my bike in the car and I never raced again. I was just done. I mean, I was like, I hung it all out there. I was done, depleted, and it was no fun anymore. I mean, I was in a sense of wonderment in the beginning because I was getting away from the cops and the firemen and the drinking, and then as I got more competitive in the sport, it just didn't feel right. So my doctors that were working with me, I was deficient in growth hormone. I was deficient in testosterone. So I used growth hormone. I used testosterone. I used it all to rehab my body over a 3-year period.
Severely damaged when you do that.
Yeah, it was. It took me about 3 years to rehab my body, and again, I wanted to see how much muscle mass I could put on at 50 years old.
But when people walk around and they look all jacked up, they don't think that.
Yeah, I didn't like that feeling.
My body's damaged.
I like to be able to run because running for me, only for me, is a natural antidepressant for me. And you've got opioid receptor sites on your central nervous system, and I think by producing endorphins when you run, that just calms me down because I'm like ADD and I'm all over the place. But if I run, I could give lectures. Like I worked out before I came here so I could talk to you. I'm not too old.
Well, I worked out too this morning, so all right.
Yeah,
the only one that's showing
you're 20
off.
years younger than me.
Oh boy. How about let's talk about, because we're on testosterone, but let's move into, since we're on endurance athletes and stuff and athletes. Let's talk about how the endurance side of the sport damages the gut and the heart, because a lot of people don't think about that. Well, look, I can run a marathon. I can do a Disney marathon that's, a quarter marathon, a half marathon, and then the third day you do a full marathon. I can do the 3 days in a row. Look at me, I'm super fit.
Yeah, that's called a goofy.
Yeah, so how does that damage somebody's heart where they might not be thinking about it?
Yeah, what do I say to somebody? And I have people like that because, like I said,
what do you tell them? They can do a marathon.
No,
I'm fit. What are you talking about?
I still deal with all the endurance athletes here in town, but I help them when they get sick. And I've got guys right now that are coaches. Jeff Cutterback's a coach. Rob Beans is a coach, but they never call me because I think they think I'm going to steal their clients. I'm not. I just want to make sure everybody stays healthy. And it's crazy, but I'll have people that say, "Listen, Russ, I want to do the." I want to do the marathon, the half marathon, and they want to do those 3 races.
A lot. People train for a year to do 1 or 2 marathons a year.
Yeah, and physiologically, I don't think they know. And listen, I'm all for the challenge.
Yeah, sure.
I'm all for climbing K2.
Not shooting that down at all.
The mountain climbers are sharp. They're the sharpest people on the planet. They actually pass dead bodies on the way to the top of K2 of Mount Everest. They pass frozen bodies. So what a reminder.
Yeah, right.
When you're running a marathon, physiologically, it's like taking your car across the United States. Don't you want to get some baseline blood work? And maybe people just don't do that. I mean, they're getting better, but that stuff really damages your body. I mean, I thought I was healthy with fast race times, and I'm hanging out with 40, 50 people. I'm doing 100-mile bike rides, not at a fast pace, but on every Sunday morning out in a place called Windermere.
Yeah.
And
well, let's talk about the heart. So what does it do to the heart when you run a marathon or you're running for that long? And it does the arteries in the heart, and what does it do to the arteries? And then that downtime is when it's really dangerous, right?
Yeah.
Tell us about that.
When you run, first of all, our bodies are not designed to keep our heart rate up. Like a lot of these athletes run intervals to get faster, and they keep their heart rate between 160 and 180. Mm-hmm. That could damage the electrical pathway of the heart. Like there's a arrhythmia called atrial fibrillation. And again, I don't know more. The cardiologists get upset because I've been collecting data on athletes since 1984 on atrial fibrillation on the arrhythmias, because I was a paramedic putting people on a monitor, and then I'm racing as a triathlete, and then I started seeing these triathletes with arrhythmias. So I'm thinking, all right, I'm going to collect this data. Well, now when I bring this into a cardiologist, he says, well, are you a doctor? I'm like, no, but we've been collecting data since '84. You got a marathon runner or an atrial fibrillation. You may want to take a look at this, and that's kind of there's sort of a reverse icon intimidation. I know doctors don't know everything and they need help, but doctors look at me and think, oh, since you're a guy, how can you have all this information? So, it goes both ways. So you could damage the electrical pathway of your heart, okay? You could, with the high carbohydrate diet, you could cause imbalances in your intestinal tract. With every foot strike, you strike the ground with your foot when you're running. That's called compression hemolysis. That's a big word that says you break up red blood cells with each foot strike. Yeah. Listen to this. With each mile you run, your intestinal tract bleeds a little bit. Oof. Yeah, so these are the things that, nobody talks about.
How about the expansion and contraction of the arteries around the heart?
Yeah, well, when you train, when you do the lining of the arteries is called the endothelial lining. I videotape marathon runners on the Russ Scala YouTube channel and other triathletes that I work with that have had heart attacks. Well, why did that happen? And this is, a cardiologist will sit and look at an athlete that's tan, fit, they look really good, and all of a sudden, and they're like, well, how could you have a heart attack? Well, it's the training. The training can damage the lining of the arteries, and that's some of the new stuff we're going to talk about in the next few video shoots we do. I'm going to show you how you damage the arteries that way, or the endothelial lining. Actually, racing and training for a marathon can be very damaging and unhealthy for you, but you got to be careful.
People are still going to do it.
Yeah.
So he's going to do it smart.
Yeah, you just want to do it smart. Now, like I said, I'm not trying to ring on anybody's goals, but I always ask people. I said, if you guys are going to drive from here to California in your vehicle, what are you going to test? Oh, well, we're going to look at the tires, the oil, and everything like that. I go, okay.
Oil change,
if you're going to run a marathon, what are you going to test?
Your spark plugs.
We're not going to
test nothing. I'm just going to eat my protein shakes.
Yeah, exactly.
And drink these energy drinks.
Smoothies. That's why we shot that video. Smoothies make you fat.
Smoothies. Sugar.
Yeah.
All right, good deal. So let's go into some